Okay, we're live.
Okay, I would like to call this meeting to order. Paramedic Services Committee agenda, Monday, October 19th, 2020. We are streaming on YouTube, but there will be likely an in-camera portion at some point. Attendance has been taken by our clerk. Can I get a motion to approve the agenda? Moved by Mayor Bailey, seconded by Councillor Pierce. Any questions, additions, deletions? Seeing none, I'll call the vote. All those in favor? None opposed. That carries unanimously. Any declarations of pecuniary interest? Seeing none, we'll move to delegations, petitions, presentations. We have none. Keep looking over here at my other screen with the agenda on, just so people know. Adoption of the adoption of minutes from the previous meetings. Anybody care to move that? Mayor Bailey, seconded by Councillor Sless. Any corrections or anything to say about those meeting minutes? Seeing no comments, I will ask for the who approves that motion. Carried unanimously. Moving on next, business arising from the minutes. We have the Paramedic Services budget piece here. It was deferred at the last meeting. We wanted more further information. Who'd like to speak to this? Is there anybody who wants to speak to this piece? Michael Bradley.
Good morning, Mr. Chair. Just can you give me a thumbs up that you can hear me okay?
I can hear you great. You sound perfect.
Sitting here in the splendor of the mayor's office, and I'll just indicate that the budget, the draft 2021 budget for paramedic services was presented at the last meeting, and the decision on approval of the budget was deferred to a future meeting to get some further information. So if I look at the agenda, this is listed under business arising from the minutes because it is an outstanding item. The first item we've got is an in-camera item. It involves labor relations and employee matters. So I think if committee would like to discuss that, there should be a motion to go in camera, and then we can discuss that. The second item is some options that we provided that was requested on different transfer to reserves, noting that we had decreased the transfer to reserve last year as a cost-saving initiative. And the staff recommendation is that we return that decrease back into the reserve, so the reserve has adequate funding to carry it through the next 10 years. And then the final item we would propose would be, depending on what committee wishes to do with those decision packages or options that we've provided, then we would propose to approve the budget today. Noting that if committee still wants additional information, we've still got time to further consider the budget. So, thank you, Mr. Chair.
Thank you. How would committee like to deal with this? Does anybody want to move some, all, or move to go in camera? Councillor Pierce.
Thank you, Mr. Chair. Through you, obviously around the table here, but personally, I don't have any questions or concern with it. I appreciate the fact of the extra information they came back with. It makes it a little clear, and I'd be willing to move the recommendation if nobody has any issues and we don't go into camera.
Okay. Councillor Sless, are you seconding that, or do you have a comment?
No, I just had a question, if I could, Mr.
Sure.
Chair.
Absolutely.
I keep hearing the word approve the budget. We'll be recommending the budget, correct?
I guess that would make more sense. I can shoot that to staff just to get the official word, but yeah, I think it's that we'd approve the decision package. We can't approve your budget and you can't approve our budget as councils, but that this committee recommends the budget as presented. Is that correct, Mr. Bradley?
Yeah, I mean, my apologies, Mr. Chair. That is correct. This committee would approve recommendation of the budget to the two councils for their individual budget processes.
Okay, thank you.
Could I get another clarification?
Please.
And that was, I forget where I read it now, but by rounding or going to one decimal, it changed the it changed the portions of each municipality. And could somebody clarify that and just explain that to me a little more in detail?
Sure. Yeah. My understanding is that the formulas change very slightly. I think from like 73 point something percent to 72.5% for Brantford. But Staff Bradley, would you be able to comment on that decimal point piece?
Yeah, thank you, Mr. Chair. I would actually, the treasurer is on the line, maybe she
Oh,
can join
okay.
us and
Heather.
address the question.
Sorry about that. Heather, could you speak to that?
Yes, through you, Mr. Chair. Initially, when the cost sharing percentages were set through, they were set through with 2 decimal places. Traditionally, we've only used 1. And when I reviewed the city's budget call, they were using 1. So to correct and match what so the city and the county were on the same page, we did just alter it to the 1 decimal to match what the city had instructed all their staff to do.
And just so if I can clarify, that lowers the city percent by a minute amount, but is that correct?
It actually increases the city by $600.
Okay, so it was a $600 change to match the city's accounting practices.
Correct.
Okay. Is that something new this year? Is that why it wasn't brought this way in the first place?
No, it's not new this year. When the information came with 2 decimals, I didn't question it, and I should have. It should have
Okay.
we only should have used 1 right away.
Okay, thank you.
Okay, so we have, I believe Councillor Pierce was moving all 3. Did we have a seconder for that? Seconded by Mayor Bailey. Any further discussion? We've had some clarification points, but any discussion? Councillor Sless.
Yeah, it's just I'm kind of out here on an island by myself, I guess. The other 2 got voted out. So I'm not really sure how this is going to work. I would presume when this hits the city, you're going to have further discussion simply because they couldn't make this meeting. So that discussion will take place at that meeting, which will be city only. And then I would presume that there would be things coming back to this committee from the city. That would be my presumption.
Yeah, that would make sense. I mean, that's part of the regular budgeting process with this joint service. So,
well, I think we can guarantee that'll happen. That's all, Mark, with them not being here.
Oh, okay. Well, that's fine. And again, just for those watching, we received notice that one of the members of the city staff, city team wouldn't be here, but yeah, I can't speak to their attendance. People, this sounded like the best date to do it based on the emails. I can have the clerk comment if need be, but it's interesting times. Yes, Councillor Sless.
Yeah, I think the COVID situation has made the mayor's schedule really erratic. Things happen in the night, and then he's in trouble the next day, but he doesn't realize it when he goes to bed. So this has been happening constantly with his. I'm glad I'm me and not him. Put it that way.
Fair enough. Yeah, absolutely. So that again, the process will be though that your folks and our folks will all talk about it, and it'll come back to this meeting if there's anything up the chain. But we still, again, we're moving the budget piece at the request of the city because the city asked for it early, and then we've deferred it because the city asked for more questions to be answered. We've answered those questions. Also, I'd recommend too that any member of the committee can email any member of staff or the chair, myself, to discuss anything that's been in their inboxes for the last couple of weeks, and we can or the next couple of weeks, and we can move on from there. But we do have a motion on the floor. I guess it's been spoke to. Councillor Sless, do you have anything else on this?
No, that's fine.
Okay. Anybody else have any questions, concerns, comments? Okay. Well, seeing none, we'll call the vote on the three items arising from the minutes. Okay, passes unanimously. Next, consent items received as information. Heather, I believe you want to talk about the Paramedic Services third quarter budget to actuals.
Through you, Mr. Chair, I can take any questions. It does appear that we're going to be slightly under budget at the end of the year.
Mm-hmm. Somehow, some way. Councillor Sless.
Yes, just through you, if I could, Mr. Chair, to the treasurer. How does that work? Does that money stay within the municipalities, or is that returned to the ministry, or where does that, if there is a surplus, where does that go?
Through you, Mr. Chair, the province guarantees funding up to 50-50, so long as our budget is over like 50% of their funding, then we're good. If we drop like we're under budget too much, yes, some of that money has to go back to the province. They will not fund us over 50%.
Councillor Sless, sorry, do you have a follow-up before I have one? Councillor Sluss?
Looks
I
like
think
he's
he-
frozen.
I think he may be frozen. Okay, well, I will ask a follow-up question and see how that
Having to
goes.
work now.
Oh, there he is.
Or-
Okay, can you try that again? You're having some technical issues there, Councillor Sluss.
Okay, can you hear me now?
I can hear you, yeah.
Okay, I get, my question to the treasurer was, just following up on that then. So based on what you're projecting today, would that money be going back to the province, or would that be staying with municipalities?
At this point, I think we're safe that we'll be able to keep the funding that we have been allocated.
It would stay locally.
Yep.
Okay, great. Any other questions to Heather? Okay, seeing none. How do we want to proceed with 7A?
Receive his information.
Okay, receive his information. Seconded by Mayor Bailey. All those in favor? And passes unanimously. Consent items we received, option or number 7B. There's some statistics here from Russ. Russ, do you want to chat?
Through you, Mr. Chair. You good? Okay.
We can hear you.
Chair. We've noticed that year to date, right now, we're down about 8% of the call volume, but the calls are starting to creep up again. So we anticipate by the end of the year a 3% increase overall. At the previous meeting, Councillor Pierce did ask a question, and I do apologize for the information being delayed. The question was that how close are we for the 6-minute rule of meeting a AED or dealing with cardiac arrest? Currently at the 6-minute mark, we're at 51% of the time year to date. If we go up to 7 minutes, it's 68%. 8 minutes would be 75%. 9 minutes is 90%, and 10 minutes would be 96%. The standard rule with heart and stroke and the ILCOR guidelines is they measure it having an AED or some type of assistance within 6 minutes or less. Last year in 2019 at 6 minutes, we were at 50%. So even with the call volume and COVID going on right now, we've improved by 1%.
Councillor Pierce.
Thank you, Mr. Chair, and thank you for that, Russ. So just for clarification in my mind here, so that 6 minutes or 7 minutes or that time frame is from the point in time where your pagers or whatever goes off that you have a call at X address, away you go, right?
It's measured in different ways. How they measure it is the 6 minutes of, yes, we are notified, but the clock stops even if you have an AED on scene at the time the patient collapsed. So
Okay.
if you were at the Gretzky Center or another arena, somebody goes into cardiac arrest, one of the questions that the dispatcher asks, is there an AED available or is there an AED by the patient's side?
Right.
If that's the case, then the clock stops immediately, and that one will be a tick mark of 2 minutes. If there is no AED going to a household or something, and it took us 9 minutes to get there, it's now 9 minutes as they calculated.
Okay, so and thank you for that clarification, because that's kind of where I was leading to here. You know, it seems over the last couple of years there's more and more of these AED units out and about, which is fantastic news. So I appreciate you kind of connecting those two, because that was going to be my part B of that is that does that take effect if you're in a situation where one of the AEDs are available? So I appreciate the extra effort there, and thank you for that info. It's great news.
Councillor Sluss.
Yes, I'd like a little deeper on this 8%. We're currently 8% below where we were last year in call volume. Did I understand that correctly?
That is correct year to date.
Okay. What assumptions are being used to say in the last 3 months we're going to go up that 8% plus additional to make it an increase?
On
What's that based on?
Through you, Mr. Chair, on page 2 of 7 of our statistics, if you look at our January, February, and March numbers pre-COVID, we were averaging 18 to 2,200 calls. From March down to July, maybe even May, we're down to 1,600, and now we're continuously spiking up back to the 2,000 range or more for our call volume. So now that everybody has gone back to normal, coming to the emergency department, calling us, right? So the low of April of 1,300 calls per month is now going back up to 2,000 or more. So what we did was we took all the numbers for the entire month, broke it down over 12 months, and that would be our forecast.
Okay.
Please.
We're just going into a spike. I just wondered if that would flatten things again. No?
Right now, with the second wave of COVID, we do not know how people are going to react. Some people will continue to stay at home, which what we experienced before, not going to the emergency department or their family doctors, or people with the second wave and the numbers are spiking, right? Our volume could go up past 2,000 because people are getting sick, and the second wave, they say that it's the worst that's going to be hit rather than the first wave that we did.
Okay, thank you.
Just a couple of questions myself, Russ. First, we do tend to have increased numbers in the last quarter of the calendar year, correct?
That is correct with the flu. Just going on information what we received from talking to people I talked to in Australia, the flu season was almost non-existent because everybody was hand sanitizing, masks, no sneezing, covering up and all that. But we're going back into the flu season. It's recommended everybody get their flu shot. And we've started mobile flu shots for the people that can't get out. And also for the emergency service personnel, police, ambulance, and fire, we're going mobile and stuff and making sure they get their flu shots first.
And also during that time that call volumes were down for this portion of the year, you were implementing things like help with COVID testing and other sort of community wellness programs, PPE collection, et cetera, related directly to COVID, which isn't normally caught in our traditional statistics of call volume, correct?
Through you, Mr. Chair, that is correct. We assisted with the medical officer of health going to long-term care facilities, people that are going into long-term care facilities, providing the swabs in-home, getting the results back before they actually entered. And now with the second wave for EMS, fire, and police, we have a rapid COVID swab testing in front of our Henry Street station for themselves and their immediate family in their house, so we can get the swabs taken care of to the health unit, right, and they can get back to work as soon as possible.
Great. I just want to ask one more thing. My understanding is you've been, your staff, I should say, have been without a contract since April. Obvious reasons why with COVID, et cetera. How's morale generally now that we're over the first spike and going into the second spike, and with the other things that are happening just generally?
Through you, Mr. Chair, in discussions with Michael and Cindy and stuff like this, we're doing our best to keep morale up, right? People are actually working together. Knock on wood, none of our staff have been affected by the COVID virus, right? We've remained at 100% staffing. And I think the biggest thing we have is the clear transparency and communications we've provided to our staff. That's going a long way. We don't know what the second wave will be done, but once we started in March, we started stockpiling our PPE to make sure our staff were protected. And they knew that with the support of Michael and Cindy and some things we've done, is that they are protected, and we're doing our best to maintain good communications and overall morale. Hopefully we can get to the contract soon, but with the second wave, we might be delayed further.
Okay. Well, thank you so much, and just on behalf of everybody on the committee and the county and the city, just thank you to your team for being great frontline medical emergency responders during all of this and all the uncertainty of the many seasons of this year. So I just want to say that.
Thank you very much.
Councillor Pierce.
Thank you, Mr. Chair. Through you to Russ, just one quick question when it comes to the page there with the offload times and offload delays. Our stats show that the number of calls is down, and because of through the heavy months of COVID and stuff like that, and yet the offload times at the hospital seem to have gone up in 2020 as compared to 2019. I'm curious if there was external factors other than COVID that have affected that, because my understanding, through the heavy months of COVID is there wasn't many people going to the hospital. So I would, I'm assuming here, which I shouldn't, but my assumption is the fact that there wouldn't be as many people to cause delays with the offloading. I'm wondering if you could speak to that a little bit.
The offload, first of all, for our calls are taking longer because as we show up at scene, we have to put on the gowns, the appropriate. Yep. But when we get to the hospital, the process is a lot longer, especially if somebody has been screened COVID positive. So normally if we would just bring somebody in with a fractured ankle and there was not offload delays or less amount of patients, right? We'd basically be able to fast track all the way through. But with everybody being screened positive through our dispatch center, and as we come into the emergency department, right, that created longer delays. And also in the emergency department, if you'd walked through there back in February and March, we had beds lined up in the hallways. Through the COVID times and even till almost about 2 months ago, those external beds in the hallways were non-existent. So we had less bed capacity in the department. Myself, Michael Bradley, the CEO of the hospital, Dr. McNeil, have had conversations. And as of 2 weeks ago, they increased the bed by 12. They have 8 rapid assessment beds, and we are going back to normal. They are putting us as a priority to get our crews in and out of there. So we've noticed a decrease over the last couple of weeks, but that would not be reflected in this month's stats.
Okay, thank you for that explanation.
Yeah, so thank you. Any other questions before we make a motion of some kind? How would committee like to proceed? Somebody put a motion on the floor.
We should receive that.
There we go. Thank you. Moved by Councillor Sless, seconded by Councillor Pierce. Okay, all those, any questions, I should say? No, all those in favor? Carried. Okay, we have no staff reports, no further communications. Next meeting at the call of the chair. And again, if there are special times and dates, just to be transparent, because we're streaming, we give a multitude of options for the committee members, and we try our best to accommodate as we can. But yes, anybody can reach out at any time, and also including to Russ and Heather and Michael and anybody else they wish to communicate with. Okay, so next meeting call the chair. Motion to adjourn. Mayor Bailey, we are adjourned. Thank you so much for your time, and thank you again.